Welcome to the Susan Brender Show. It's all about you. Featuring shows on health and wellness, the performing arts, politics, and people who inspire you to be your very best. And now, here's Susan Brender.
I'm Susan Brender, and this is the Susan Brender Show. Today I have a very interesting guest on my show. His name is Dale C.Smith D.D.S. Now, I've never done an interview with a dentist, but I feel that my show is all about vitality. And as far as I'm concerned, when you have very, very healthy teeth and also that you take care of them, it makes you a very vital person. And I'm sure that my guest will say that when he works on people, even though not everybody loves going to the dentist, when they walk out, they feel clean, they feel good, they feel like they're just $1,000,000. Now, Dale went to the University of Temple University, and he went to Emory University, and now he is a dentist who is absolutely somebody who believes in what he does. And I want to welcome to our show Dale C. Smith.
Thank you. It's a pleasure to be with you.
Well, you know, let's start from the beginning. Why do you think that so many people do not go to the dentist regularly?
Well, there's a number of reasons. I mean, everybody has their own specific mindset about going to the dentist. For many people, it's just embarrassment about their condition. And the amount of time has passed between one visit and the next, and they're afraid that when they go to the dentist or the hygienist, they're going to be scolded. And so this is sometimes just a matter of not wanting to be treated like a child by the dental or the dental dentist or the dental practice.
Yeah.
Another major reason is violation of the personal space. When you go to the dentist now, the chairs lie all the way back, and patients, the dentist or hygienist is right there in their face, working in their mouth, and it's a very personal area of the body. And a lot of people feel like they're claustrophobic. And the way to overcome that is just to, ask for a little space if you need it, and then give a break. And I think people on the dental end will be happy to accommodate you.
Mm-hmm.
Okay.
Excuse me for interrupting.
Sure, go ahead.
Now, I would like to first, before we get really into what it's like to be a dentist and how the people respond, what made you want to become a dentist? Because not every dentist really loves his job. It's giving people pain.
Actually, many dentists are not happy in their profession. It's a difficult area of work. You're right. Many people do not want to come. There's a lot of fear associated with coming. And the last place they'd like to be is at that dental office. And so, but in my case, I really wanted to be a dentist all my life. My father was a dentist. And everything that I heard about how he practiced and the way that his life went while he was a dentist, he was enjoying it very much. And I thought it would be the same for me.
So it was, I'm going to call it a genetic thing, predisposition to becoming a dentist. Okay, so let's get into the real facts. Okay, so when should a person, or a child actually, when should a mother who has a child take her child to the dentist? What's the earliest that they should go?
Well, usually for children, the first teeth that come into the mouth are the incisors, the two lower front teeth typically, and they come in around 6 months of age. Now, at that age, of course, the child doesn't really know what's going on, but it's a good time to bring the child in, maybe when you're getting your teeth cleaned, or another time just to walk in the office with the mother, be held by the mother, maybe even lie in the mother's arms while the dental hygienist or dentist just looks in, and make sure that the jaws are developing properly and that the teeth are in the good position. And the most important part of that first visit really is just to create a positive experience for the child. And mothers out there, please be aware that what you say, especially when your children get a little older, really impacts their attitude about dentistry and going to the dentist. And it can go on for many years. So if you're talking about don't worry, the dentist won't hurt you, those aren't really the best words to use. It's better to talk about we're going to go and see the dentist, and if you're really good, it'll be nice to meet them, and they might even have a little present for you.
That's an interesting way to approach it. Now let's talk about adults. A lot of adults, as you said, have claustrophobia and various other things that scare them about going to a dentist. Now, if a person who has a lot of issues with their mouth doesn't go, obviously they're going to have a problem. So when they go to you and they feel all this worry, fear, you name it, how do you approach them?
Well, I believe in sharing the real reality about what's in the patient's mouth with them, and then taking them out of the world of not knowing what the conditions are, what's going to happen to them. As soon as the dentist knows what's possible, what can be done to correct it or to take care of things or to prevent problems in the future, share those things with the patient. What I do is I take photographs of my patients, and then I show them to them a second visit so that they understand exactly what we're seeing, and it's not that complicated or difficult to look at one tooth on a photograph and see that it's in good condition, and another one looks like it needs some help. Mm-hmm. And so then we discuss the different options, and lots of times people feel much more comfortable when they know their options and they know the consequences of doing nothing or taking care of it in one way or a different way.
Yeah. So here's another thing that I want to know, and that is that some people find a dentist, they go, they get their teeth done, and then the dentist tries to tell them that they should have more things done with their mouth. They should get a bridge, or they should have their teeth whitened, or various other kind of things that cost a lot of money. Now, if you know that a person has all these issues, would you recommend that they do, that they sacrifice, I'm going to call it sacrifice, and get everything that they have to do done? Or would you say to them, okay, listen, you don't have much, so we're going to wait? How do you approach that?
Well, I think it's just good to empower the patient, to let them know they're in charge of the final decision. They may not be the best person to decide what might be the best choice or the second best choice. Try to come to a meeting of the minds and an open communication about what's really going to work best for them now. Mm-hmm. And many dentists are just as uncomfortable about that situation, where it's a emotion-packed decision. There's money involved. There's the fear of pain involved for many people, and sometimes the dentist and the patient don't even know each other very well when these kinds of decisions are made. And so I think it's good to not move too quickly, give the person a time to come to a feeling of comfortable or uncomfortable decision about whether they think you are the right dentist for them. Mm-hmm. And also for the dentist to have time to evaluate and see if they really think they're the right dentist for the patient.
Right.
And if there is a meeting of the minds there and there is a understanding and a trust that develops, then it gets much more comfortable for everyone.
Mm-hmm. Now, what about the myths that take place? I mean, people think that you have to do certain things. Let's talk about different issues like that. Now, for example, there was a time where they used to put silver, when you had a cavity, you got a filling that was silver. Today, they're taking out all the silver. Why is that?
Well, there's better materials, in my opinion, than the old silver amalgam fillings. The old fillings were a mixture of mercury, which is no longer even allowed to be used in Europe and many countries, and other alloys that were almost in a powder form compressed into a pellet. When those two are mixed, they harden and form an amalgam or a mixture of silver and the mercury. And so those fillings were good. They were the only thing really available that was inexpensive in the early days of dentistry. And it carried on, and some dentists still use it. It can last many years, but there are some negatives to them. One, for many people, is the mercury, and they don't want that in their body. For other people, it's just that they don't want a black filling or an unattractive filling. They'd rather it be white. But from my perspective, the more modern materials, whether they're porcelain or composite resin, which is also a white type of filling, they've advanced enough that they can work for many situations where silver fillings used to be used in the past.
Mm-hmm. I see. Okay, let's now talk about fluoride. Everybody that I know, including myself, are always told that we need fluoride in our in all our, I'm just about to call it, in our toothpaste. Yes, in our toothpaste. fluoride is a very important thing for our mouths. Is there truth to that?
Absolutely. The effect of fluoride in the developing years, when the teeth are actually forming in the jaws, having fluoride in the water supply or in a tablet form that can be given to children during those years has a huge impact on reducing decay problems for that tooth and for its lifetime. It's not a 100% reduction in decay, but it's well over 50%, and many studies show it's up around 80%. And so it's been an amazing difference for patients, especially children, and especially underprivileged children, where they don't have the funds or the access to get to a dentist on a regular basis necessarily. It's a great benefit to have fluoride in the water supply in your community because there's much more dental disease without it.
Now, once you deal with somebody and they come into your office and their teeth again look pretty awful, is nutrition and what kind of food causes cavities, causes teeth to be really lousy? And do you recommend any particular diet for people so that they have great teeth?
Susan, that's a great question because it moves us into the area where what can people do themselves that cost virtually nothing in changing their lifestyle so they have far fewer dental problems. And that's true for cavities, that's true for gum disease, and those are the two major diseases that cause people to lose their teeth. So in talking about decay or cavities, the biggest culprit there is a high sugar intake or a frequent sugar intake in the diet. Some mothers think it's calming to the baby to put the baby into the crib with a bottle of milk, and there's a lot of sugar in the milk. And if the baby is suckling on that all night or for an extended period of time, they can end up with a lot of decay that could be avoided if they just had water. For the children or all people really, if you are able to reduce the amount of carbonated sodas, in particular sodas with sugar in them, like Cokes, and I think the worst is Mountain Dew, okay? Wow. There's high sugar in these drinks, and if you have it as a habit where you're especially having it 4, 5, 6, or 10 times a day, and it might only be a little sip, then every time you do that, the bacteria that are collected on your teeth become active for about 15 minutes, and they release acids onto the teeth. And so a person that really loves Coke, if they can just reduce it down to 1 time a day or twice, they're going to have a lot less decay than if they drink all day long.
Now, here's something I'm very interested in knowing, and that is, does a dentist treat patients with special conditions? Is there a specialized kind of dentist who deals with handicapped people, people with diabetes, HIV, AIDS, autism, special needs children? I mean, is there one kind of dentist who deals with that, or is it just a general dentist?
Well, there really isn't a specialty in treating handicapped or disabled children or special needs people. But some dentists are trained more in that area than others. Many times an oral surgeon that can sedate the patient and more typically uses that type of anesthesia in the office would be the best person, and that might be in the area where extractions are needed. But a number of dentists can treat mild conditions where it's just a matter of managing behavior and drugs or special anesthetics aren't necessary.
Yeah. Now, do you use any relaxation or sedation techniques to ease dental phobias?
Well, sometimes we'll have people take different drugs that will relax them, take away anxiety. But I don't give dental anesthesia in my office other than local anesthesia.
Why is that?
Well, it just takes an area of training that I never exposed myself to. I found that for the type of dentistry I enjoy doing and that I feel like I do best, it's not necessary. And for people that are anxious or have anxiety, usually I just go slowly and build trust. And then after that's happened and I give the anesthetic slowly and with a lot of topical time for the topical anesthetic to work, which is the cream that's put in before the shot is given. If you do that carefully and slowly, and you talk to the patient gently, oftentimes it's virtually painless or totally painless, and people get over their fear.
Ah, interesting. Now, we've been pretty serious in our discussion, and I'd like to kind of deal with a little bit of a lighter subject. So,
sure.
How about telling us a little bit about an experience that you had, which was kind of funny? You must have different experiences with different kinds of people that kind of make you feel that what you're doing is real worthwhile. So, Dale, tell us a little bit about that.
Oh, my gosh. Well, the funny part, I'm not sure I can think of funny parts. The dental office tends to be a serious place, but it can be very, very rewarding for me as a dentist and to the patients, too, to overcome this fear. Or to go from, and especially also, I find it really enjoyable to take a patient that doesn't know anything about their mouth, all they really have is fear and bad memories, and develop trust, and then show them that the problems that they've been worried about aren't nearly as bad as they actually are. And then you can just see the relaxation and relief go across their faces. They go from not knowing what's wrong and worrying about the imagined to realizing that their problems aren't so bad. And then the next step that I also really enjoy is teaching my patients what they can do that will help them to not have nearly the number of problems they would have without having those skills. And I hope we have a chance to talk about those things, Susan.
Well, let's do it. Let's do it right now. So somebody comes into your office and you look in their mouth and you see, you say to yourself, oh my God, this is going to be quite a problem that I have to deal with because this person's teeth are, really bad. So give us like the process of how you deal with them, how you talk to them, what you say to them. Let me hear. Just make up a little scenario for us.
All right, I'll pretend that you're in my chair and I'm speaking to you, Susan.
All right.
Okay, Susan, I've enjoyed meeting you, and as you know, we examined you and looked over everything, and I had a chance to listen to your dental history and what's happened in your life from your perspective. Is it okay with you if I show you now and explain to you what I've learned so far? And then assuming you say yes, then I would go ahead and start to explain, well, this is what a healthy mouth looks like. And I'll show you some pictures of a good healthy bite, healthy gums, and teeth that really don't have a lot of decay or breakdown on them. And then I'll go ahead and show you the photos of your teeth. And they're going to be different. There's going to be some things that look good typically in many people's mouths. One person might have a very healthy bite, but they have problems with some gum disease, let's say, and they've got some decay problems also.
Yeah.
And then I'll explain how these decay problems occurred and how they can be prevented. And so I'll show photographs of healthy teeth and then teeth that have small cavities in them that get bigger, and then fillings in them, and then maybe crowns, so they know what happens to their teeth as the progression of decay occurs. But at the same time, I'll explain that brushing your teeth this way and flossing your teeth to clean between them will prevent this happening in the future to a large degree.
So you're telling me that flossing is one of the most important things for people to do to have a healthy mouth?
Absolutely. Because when people brush, even if they brush really well and spend a lot of time, they can clean only the plaque or bacteria that's collected, the sticky bacteria on the side of the tooth, on the tongue side of the tooth, and on the cheek side of the tooth, and on the top of the tooth. But they completely miss with the toothbrush between the teeth. And that's where a lot of bacteria collect. And in particular, the bacteria that collect between the teeth and under the gum line also causes gum problems in adults. And that's a major problem for many people. And so if a person just learns the proper way to use the dental floss, which takes about 2 minutes a day or so to do it really well, they can prevent or really make great progress on their own as far as getting their gums healthier and keeping them healthy.
Now, let's talk about technology. Today everything is technological. You see all kinds of people on their cell phones, using their computers, in their businesses. Now, how does a dentist use technology to improve his practice?
Okay, well, technology is a very useful tool in dentistry because there's a number of things about that make dentistry difficult. First of all is just really good lighting. The dentist has to be able to see well what he's doing, or he can't do a good job. And so there's been improvements in the amount of light that we can deliver to the tooth or to the gum so we can see clearly exactly what we're doing. And another advancement that has been around for a while is magnification. And so you'll see dentists wearing these funny glasses that are bigger than normal glasses, and that's because they've made an investment in being able to see more clearly and larger. And with the higher levels of magnification, better than anyone on the planet can see without those.
Wow.
And then the next level up from there is some dentists use microscopes, which take it up to a whole different level. That helps the dentist and patient because they can see so well, and they can also work more comfortably. And so a dentist that is more comfortable can do a better job as well without having to bend all the way over and have his or her neck twisted. Some of the other things that have really advanced are CAT scans that are specifically made for dentistry that have lower radiation than normal CAT scans and give a three-dimensional X-ray instead of a two-dimensional view of teeth and bone. And so this has been a major advancement, especially in the area of implantology.
Right. Now, we talked all about nutrition. What about vitamins, minerals, those kinds of things? Are they important also for the teeth?
I would say once the teeth are formed, yes. Before they're formed, rather, that's when it makes a big difference. Certainly, having enough calcium in your diet does help the bone be stronger, and it resists osteoporosis. Oh. And so these things can be a factor, especially in the female population, and fair-complected women are more prone to having problems with osteoporosis.
Now, wait a minute. Let's stop for a second, Dale. Are you relating osteoporosis to the mouth? Is there any thing that makes the mouth have osteoporosis?
Well, the bone that supports the teeth is the jaw. It's the lower and upper jaw bone of the body. And if there's osteoporosis in the legs or knees or joints, you can also see it in the jaws. And so the bone would be more porotic, less dense, and more susceptible to difficulties, and then also less supportive of implants if they were ever considered. So it's good to have good nutrition all the way around. A healthy body helps to support a healthy oral environment, healthy mouth.
You know, there's a song, and I'm sure you know it, where they say the bone is connected to this bone, to that bone, to all the bones. This is the first time I actually understand that there could be how do you say it, a porosis mouth?
Osteoporosis.
Mouth. Wow, that's fascinating. So when somebody, again, comes into your office and you take a look at the bone in their mouth, and you see that it's like osteoporotic, I guess. Forgive me, I don't know how else to say it. But the first thing that you do, what do you tell that patient?
Well, it's not really something that I focus on. More the medical doctors are involved in treating that problem. Okay, and so we might mention, gee, your bone doesn't look like it's quite as dense as we see typically. But I'm not going to make the diagnosis of osteoporosis from a dental X-ray.
I see. So do these problems most often affect senior citizens, and what can they do to keep their mouth and teeth healthier?
Well, there's dental disease all through life. I'll tell you that primarily the people in their more youthful age are hit with decay problems. And what they can do there is brush and floss and see the dentist on a regular basis. And reduce the amount of sugar you have in your diet. And then when we move into the middle years, get past the teens, into the 20s and 30s, on through life, there's still decay, but it drops off and is less common. And the disease that takes over then is periodontal disease or gum disease, where the bone around the teeth is destroyed. Oh, boy. And so one of the things that people will notice sometimes, but not always, is some bleeding when they brush. And bleeding from the gums is not a normal finding, and it's usually an indication of a problem. The other thing that people can, and it's the same thing, brush and use the dental floss. That's the thing you can do at home to keep the gum disease from developing or keep it from getting much worse quickly. But the most important thing that people don't do is see the dentist on a regular basis and be examined thoroughly, okay? The dentist, in my opinion, should check patients, and they should examine patients thoroughly, separate from the dental hygiene visit, so that they know the patient's mouth and have a chance to have a one-on-one discussion about the different possibilities to develop a plan for that person's health. It's like if someone was going to take a trip across the country. I feel like going to Kansas, and they just got in the car without a map. Unless they've taken that trip before, they're not going to really get there very efficiently. But if you have a plan for your own dental health, and a good diagnosis has been made, and the plan that's been agreed upon is what you want, then you're motivated to get there. And if it's a good plan, and you do the things that are involved in having success, then it's far more likely you can have health and a good functioning bite and a nice, pretty smile or healthy teeth for much longer and potentially all of your life.
Yeah, very interesting. Now, here's another thing I'm curious about. You know, a patient's rights in the dental office are often not fully understood by the patients themselves. You know, understanding how certain rights apply to dentistry and dental should be a priority for every dental patient. Don't you agree? Certain
rights, is that what you said?
Correct.
Yes. Well, the patient has certainly they have rights. They're individuals, and we all have autonomy and freedom to make our own decisions.
Mm-hmm. So, but if just turn things around a little bit. Now, of course, you're talking as a dentist, and you're giving us wonderful advice. But now, put yourself in the chair and put yourself in my seat.
Okay.
Now, the first thing I want to know is, knowing what you know about being a dentist and all the dental problems, when you walk into a dentist's office as a personal person, okay, for lack of any other way of describing it, start from the beginning, knowing what you know. What do you say to your dentist?
Well, I think it's fair to say what you want. Say what you're looking for. Ask what's possible for you. I think everybody is different about what they want. I can't decide for people how healthy they want to be dentally, but it's a good thing to communicate to the dentist and to even the secretary that's answering the phone, the receptionist, so that what you are playing an equal role in this dental-patient relationship. The old scenario where the dentist decides or the doctor decides everything, the patient just sits there passively and says yes, okay. Really is not a good health model, I don't believe. I don't think it's a good model for dentists to practice under or for patients to be treated under. So if I was the patient, and I have been the patient in the dental office, I'll speak up for what I like and what I want and what my concerns are and ask questions. Mm-hmm. And then if the dentist is skilled and capable of answering those questions and giving you the time to be heard and validated, and you feel comfortable, and you would stay. But if you are uncomfortable and you don't feel it's the right office for you, I would move on.
Okay. Now, here's something that I'm interested in knowing, and that is about, say I've been told that I require several root canals and crowns on my teeth, which are, have never given me any kind of pain or discomfort, but obviously, there's a reason the dentist is telling me this. Now, I've seen, say, my dentist for about 10 years, but for some reason, I'm not comfortable with his diagnosis. So what should I do? Should I go for a second opinion? What should I do?
Well, absolutely. I think you should ask for either clarification from the person. One thing that I think is very useful is to be shown the reason why he feels this is necessary.
Mm-hmm.
Okay. And many dentists use photography, or they can give you a hand mirror if you've got your glasses on and you can see it clearly enough with good light. But I found I used to give a patient a mirror for years, and I realized after a while they can't really see the details that I can because I'm wearing those special glasses that zoom in so big.
Right.
And so I've moved on to using photographs, and a photograph is really worth 1,000 words. Yeah. And so it's not rocket science. I mean, there's cracks in teeth that develop. There's a number of things that can cause teeth through time. The silver fillings that we talked about, the amalgams, they tend to cause many more cracks than the plastic fillings do. And so these people that have had fillings like that for many years and large fillings in their teeth, they end up with cracks after about 25 or 30 years. Mm-hmm. And it's not unusual at all that dentists will want to prevent the tooth breaking and talk about maybe protecting them with crowns. Yeah. But if you have doubts about it, ask to see it, ask for an explanation. If you don't get the answer you want or aren't satisfied, go and get another opinion. I think that's a good thing to do.
Yeah. And this is the last question I want to ask you. Now, everybody loves to see very white teeth. I mean, various people walk around in there from smoking and from drinking and various other reasons. Their teeth are really dark, yellow, horrible. And so now there are all kinds of things on the market that help you get white teeth. Do you think these things are safe?
Okay. Really, I think the ones that you get in the dental office are safe. And I think there are a number, I don't know, there's so many products. You see them on TV all over the place popping up. Mm-hmm. I think that they're generally safe, yes. How effective they are from one to the other, I really do not know the answer. But I know that the ones that are made in the dental office are made, they're either using a light that is applied by the dentist, and the gel, which is the actual bleaching agent for the teeth, mm-hmm. is applied in a very specific and exact way. So you get a better result with the dental office involved, but the cost is higher. Some people go to the alternative and they're satisfied. Right. But no, I've never really heard that the bleaches are damaging to the teeth, and some studies seem to indicate quite strongly that it's not.
I see. Well, today my guest has been Dale C. Smith D.D.S. Now, Dale is a dentist for a long time, and he has great advice to give all of you. Now, Dale, I always like to give my guests the last word. Is there something you'd like to tell our audience?
Well, I'd just like to tell you all that a lot of the potential for your dental health lies with what you're doing at home, and the other portion lies with the dentist. The dentist can prevent some things, but mostly the dentist is the person that can help to repair what's broken and replace what's been lost. You, the patient, is the only one that can brush and floss your teeth every day. Even if you're seeing the dental office for a cleaning every 3 months or 6 months, that means that your teeth are up to you to clean 90 days or 100 days. And if it's been longer than that, you're going too long without seeing the dentist. Mm-hmm. The other thing that people do that gets them in trouble is staying away from the dentist so long, thinking that everything is okay as long as it's not hurting me. But the fact is that problems that have already started to hurt in the mouth are usually pretty advanced. A cavity has to get, for most situations, has to get practically into the nerve or into the nerve of the tooth before people are aware of it. Gum disease has to be very advanced before the tooth gets loose or the gums even start to bleed very often. Mm-hmm. And so the dentist and the dental hygienist are the ones that are looking to find these problems as early as they can, because they know it's always easier, simpler, and less expensive. And there's a better likelihood of a good outcome if it's caught early. Right. And so staying away from the dentist and letting the fear get in your way, it's understandable. I think it's a good thing to talk about, but don't stay away from the dentist. Try to get in there and tell them that you want to be examined thoroughly. Yes. Because you want health, and ask them, what can I do to be healthy myself? What's my part? What's my responsibility? Mm-hmm. And I'm sure they'll tell you. Well,
that's great advice. Now, Dale, if some of our audience wish to speak with you or maybe even come to you, because we have certainly people in our audience who live in Florida, but tell us how they get in touch with you and where you're located.
Okay, that would be great. My office is in Boynton Beach, Florida, which is north of Boca Raton and south of West Palm Beach. And my office phone number is 561-737-2005.
Well, that's great. So today, again, my guest has been Dale C. Smith, a dentist who lives in Florida who really understands the problems of dental problems, and also he's a very intelligent man who has spent a long time in his profession, and all he cares about is helping people. Thank you very much, Dale C. Smith, for being on the Susan Brender Show.
Thank you, Susan. It's been a pleasure.
Thank you for listening to the Susan Brender Show. To be a guest, email sebrender@yahoo.com.